It's the middle of the flu season in Canada, and this year many people have been hit particularly hard by the virus. Here to talk about the flu and what people can do to protect themselves from it is Dr. Matthew Tenenbaum with the Wellington Dufferin Guelph Public Health Unit. Hello, Dr. Tenenbaum. Thank you for being here with us.
Thanks for having me today.
Now, first, there has been more flu cases than we would normally see this year?
So all indications point to yes. We don't have an exact number because unlike some diseases we follow, we don't get every single case reported to us. But we know this time of year flu is common. And we can look at things like the amount of flu in our wastewater, number of people going to hospital for flu, and all of those trends suggest that both locally and across the province, we are seeing a lot of activity. Our wastewater data for flu, which is on our website, shows significantly higher levels than last year around this time. And that seems to be corroborated by a high level of hospital visits around flu.
Now, because of the high number of flu cases we're potentially seeing, are enough people getting the flu vaccination, in your opinion?
Well, we'd always like people to get the flu shot, and we have seen over the past couple of years our numbers come down. You know, we offer flu in our clinics, we offer flu through pharmacies in our community, a lot of primary care providers in our community order flu vaccine from us to give to their patients, and it's also administered in places like hospitals and long-term care homes. We've seen across those different channels there has been a decrease in uptake from a couple of years ago. This year, for example, to date, we've delivered about 70,000 doses compared to about 100,000 doses 2 seasons ago. We'd always like to see that number get higher, and certainly the higher it is, the more protection we're going to have. But this does seem like a particularly bad flu season, even independent of the vaccine doses we've given.
Now, are there a risk of added stress to the healthcare system with lower vaccination rates?
Yeah, so I mean, anytime we have more flu or more of anything in that mix of winter viruses circulating in our community, that's going to cause people to feel ill. It's going to cause people to go to hospital with lung problems or have exacerbations of underlying chronic health conditions. All of those emerge visits, all of those hospital admissions do put pressure on our hospitals. We know that this time of year they are working very hard given the high volumes of a whole bunch of things they see. And anything we can do as a community to reduce pressures on our hospital does help them out. This is a challenging time of year for our healthcare system.
When is the best time for someone to get a flu vaccination?
So we began making the flu vaccine available in the early fall. The timing differs a little bit year on year depending on when it arrives in Ontario. But usually in September, we begin working with places like long-term care homes to administer doses to those highest risk, with people who are at the extremes of age and people who are at greater risk of going to hospital or dying if they get flu infection. As we get more doses in our community, typically in October, we begin rolling it out in our clinics and pharmacies and in places like physician offices. That's really the best time to get it. As soon as it's available to you, based upon your risk profile, we encourage you to get it as early as possible. And it is available to you earlier if you are higher risk. The reason to go early is because we know flu activity increases as you get closer to November and December and into January. And if you can get your flu vaccine before you're exposed to flu in the community, you've already got that protection on board as opposed to trying to catch up to the level of virus circulating around us.
Now, if you've come down with the flu, what is the best course of action to take?
So when it comes to flu, for most people, the key thing is staying home, taking care of yourself, making sure you're resting up. We know flu is common. People across all dimensions of our community get flu. And the key thing is just supporting yourself, staying well, staying hydrated. And of course, if you aren't improving after a few days or if your illness is particularly bad, going and seeing your family doctor or your healthcare provider. For most people, that's the best way to manage it. For some people who are particularly high risk, or for those who are part of places like long-term care homes, they might benefit from an antiviral medication against flu. But for most people, the key thing is just staying home, keeping well, making sure someone's checking in on you from time to time, and going to see your healthcare provider if things are worsening to a significant degree, or you're not getting better after a few days.
That's great advice. Thank you for joining us today, Dr. Tenenbaum.
Thank you very much.